introduce themselves. And then, but real quick, I just want to let you know what the series will be like. Okay, so today we're going to talk about tools to drive local CQM progress and leadership. And then we'll resume again in July. We're going to go every other month. And that one will be on advising on provider CQM infrastructure. Since we are all leaders, right, we need to be the leaders and be able to advise our subrecipients. The one coming up in September will focus on advising on provider CQM performance measurement, which is always a challenge, right? And then advising on provider quality improvement project to be our final session in November. So hopefully by then we will all have a project that we can share. So thank you for joining us on this beautiful Friday morning. It's great to see you all here. So back to Michael and Jamie. Oh, and also we have Jesse. He's going to do some hosting too. He's going to show us around the Achieving Together website. Even though a lot of us might be familiar with it, I think there's some features that some of us might not know about. So we're going to do a run through and make sure everyone knows where to find the great stuff on there. And I promise that's it. I'm just moving it to.
Awesome. Thanks, Julie. Yeah, we're really excited for this conversation today and a little show and tell. Just very quickly, I'm Jamie. I'm working with Michael. We're doing some awesome stuff with Dallas specifically, and we're very thrilled and honored to be here with everybody in partnership with the state. You know, we love talking quality. This stuff gets us jazzed up and nerded out, and we're excited to have a lot of fun today. And you, Michael, I don't know if you want to say a couple of words, introduce yourself, and then I can start the prezi.
No, I think we're all good. I think folks know me. I'm Michael Hager. I am a national CQM and QI expert, technical assistance coach, and just really excited to be working with you all in Texas again for another 4 great sessions. So back to you, Jamie.
Awesome. All right. So yeah, let's take a dive in, and thank you, Julie, for opening us up and kind of giving us a little tease, a little preview of the series, kind of totally. So again, today we're going to talk about some specific tools. We're really excited in the way that this would support your CQM progress and leadership, and as Julie mentioned, sort of being that leadership infrastructure piece. We can go to the next slide, which is going to show just our reminder of those Zoom helpful hints. Folks are probably familiar with this given the Zoom land we've all been in, but just as a reminder, this recording as well as all the others are going to be available for you for sharing, or to refer back to or share with folks who maybe have to hop off early or couldn't make it. So let's dive into, I think, objectives is maybe next. Awesome. Sorry, y'all, a little bit of a dry throat today. You go meeting to meeting and then your throat gives out. So in terms of what we hope folks can gain from today and walk away with, we're going to talk a little bit about providing that elevator speech, specifically with Achieving Together, and how that ties into your AA's role in making it a reality. I'm really excited, honestly, to talk about the organizational assessment and help folks name the assessment domains within that OA that are specifically relevant to Achieving Together, right? This is sort of taking those big pictures, those initiatives, those things, and making them concrete and tangible and saying, like, where do I see myself in this? Where can my subs see themselves in this? And, kind of making things relatable. We hope folks can translate those statewide goals and processes into workable components for our service providers that are funded in our different regions. So this would include, again, Achieving Together and quality improvement project frameworks, as well as CQM performance measurements. And one thing I just want to say, this is important as like a former Part A'er. I think part of our job in our infrastructure and leadership roles is to be that sort of like liaison between statewide goals or larger initiatives, so that people who are funded in our area see like how that ties into the work they're doing or the trajectory that they are moving toward. And you kind of are a little bit of a middleman in terms of translating that into stuff they see in their dailies. And then finally, we hope folks can describe mechanisms that can be used to ensure all HIV service providers in your particular region participate in regional and statewide CQM activities, regardless of their funding source, their provider type, their service population, right? You know, if we're going to end this epidemic, we got to apply some new thinking and kind of get rid of some of those old silos that have maybe kept us at different levels of engagement. So I do want to kick it back over. I think maybe Julie and Jesse are going to do a little show and tell. First, we may have a quick little polling
let me
question.
take it. Yeah, let me take it to the poll first before we dive into our show and tell. Thanks, Jamie. And as you can tell, based on these learning objectives, we take your responses from these polls and put them into action. One of the things that we had heard from you before was that there are some challenges sometimes in getting the provider organizations to follow your instructions. So that's one of the reasons we're coming back with this next series to really emphasize that. Let me pull up this first set of polls. All right, so let's start with the basics. Since one of the main learning objectives for today is about elevator speeches, we want to know what your sense is in terms of you feel comfortable in giving elevator speeches and that concept. It's certainly full of buzz in our area. But thinking about that, the next step then, would you feel comfortable briefly explaining Achieving Together to stakeholders? And by stakeholders, we mean everybody. We mean your other AA staff members. We mean people living with HIV. We mean service providers. We mean anybody else. You know, thinking about planning council, thinking about task forces or other groups that you might have. So I see that we have a pretty good participation rate in our poll. I'm just going to wait another 5 seconds to see if we can chase in a few more before I share back the poll. All right, so let's take a look at where we are at. Share results. Okay, wait. Share results. There we go. Do you feel comfortable making elevator speeches? Most of you actually say it depends on the topic. So we're going to be working with you today to give you a method after we go through the tour to help you kind of see how you can apply directly the creation of an elevator speech based on the tour. And hopefully this would be one of those topics that you suddenly start to feel more comfortable with. For those of you who are already comfortable, when we get to the discussion at the end of this section, we'll really be interested in hearing what some of your thoughts are in terms of, you know, how you've talked about this. Most of you, 55%, actually feel comfortable explaining Achieving Together. So hopefully there's overlap between the first group and the second group. And we're really going to be interested in maybe even workshopping some elevator speeches in today's call. It's recorded, right? So it'll help benefit everybody. For those of you who don't feel comfortable explaining it yet, or it depends on the stakeholder, hopefully, you know, you'll be able to learn something and hear something from your colleagues when we get to that discussion in just a couple of moments. But I'm going to stop sharing that and move to the next slide where it is going to be tour time. So I'm going to stop sharing so that Jesse or Julie, if you want to share and to drive us around the system, that'd be great.
Do you want me to pull up the website or have you already done that? And you want?
I've got it up.
Okay, perfect.
Cool. Now y'all should be able to share since you're co-hosts. Ta-da!
All right. So the poll's nice. So it tells me that a lot of you know quite a bit about Achieving Together, but they asked to give a quick tour of the website. So if you haven't been to the website, I encourage you to go there. It's achievingtogethertx.org. It's always being updated. So this is the landing page, scrolls through a bunch of stuff, information, but down at the bottom is our mission statement or the vision for Texas, and then our links to social media. I encourage you, shameless plug, if you don't follow us on your favorite social media platform, you should. The team does a really great job of keeping that updated and doing posts throughout the week. So it's quite a bit that goes on social media for it. So first we want to go to the About tab up at the top. We're just going to do a quick tour of the website. So the About tab, just if you click on that, it gives you an overview of Achieving Together with the vision statement, the goals of Achieving Together, the 4 goals, and then some other stuff about the website. But mainly we want to go to the plan And if you click on the plan, that you see you have these pop outs of different parts of the plan. So we'll start first with the guiding principles. The guiding principles, there were 6 guiding principles when they developed the Achieving Together plan. It was built around social justice, equity, integration, empowerment, advocacy, and community. And so on this tab, if you want more information about those, you can scroll through, and it sort of breaks down each of those guiding principles and what was meant by them in the planning process. So there's quite a bit of information to familiarize yourself with the guiding principles there. The next area is the focus area. So there are 6 focus areas as well within Achieving Together. And these were areas where the community felt like by focusing on these areas, we would have the most impact on achieving our goals around ending HIV in Texas. So the 6 focus areas are cultivating a stigma-free climate of appreciation and inclusion, addressing mental health, substance use, housing, and criminal justice, collaborate, cooperate, and coordinate across systems, connecting clients, providers, and communities across Texas, providing culturally appropriate HIV prevention, care, and treatment, and promoting the continuum of HIV prevention, treatment, and care. So this will give you a bit about those, and then if you click on these, it will take you to that focus areas page where there's more information about what went into that, what was meant about it, some of the ideas and concepts around that. So you can get to it that way. You can also get to it from the plan if you want to. You can just click on focus areas and it'll take you right back there to the different areas. And then big picture is the goals of Achieving Together. The goal overall is to reduce HIV in Texas, to operationalize the idea of ending the epidemic in Texas was to try and cut new acquisition of HIV in Texas by half by 2030. And the way to do that through the goals was to reduce HIV exposure through behavioral interventions, such as EBIs like empowerment or SISTA, through promoting condom use and its syringe exchange and other harm reduction strategies. The second is to reduce HIV transmission, and to do that through TASK, which is treatment as prevention, by trying to increase viral suppression among people living with HIV, because we all know that people living with HIV who are virally suppressed are unable to pass the virus. And last was to reduce HIV acquisition through the use of PrEP and PEP. So if somebody does have a possible exposure if they're on PrEP or PEP, we know that those are effective strategies to prevent acquisition of HIV. And all of that will, working together across all of those platforms will effectively end the epidemic and reduce new transmissions in Texas. So then we've got how we measure that, our next steps, and I think everyone is familiar with this. If you're not, we call them the 90s. These are also aligned with the Fast Track Cities initiative and World Health Organization. They're aligned across all of the EHE and Fast Track City movements across Texas and the country. So the 90s are, first 90 is 90% of people living with HIV in Texas will know their status. I don't know if most people know this. Texas has the estimated largest population of undiagnosed people living with HIV in the country. So we've got quite a bit of work to do around that goal in upping our strategies towards diagnosing folks living with HIV. And then the next 90 is 90% of people who know their people living with HIV who know their status are on antiviral retrotherapy or on medications. These numbers are our baseline. So you can see like in 2012, we had 80% of people knew their status. In 2012, we had 68% of people living with HIV on medication. And then the last 90 is 90% of people living with, these get really wordy, like 90% of people living with HIV who are on antiretroviral therapy are virally suppressed. And so again, in 2012, when our baseline year is, we were at 76%. And the idea is by doing all, and then the fourth up at the top, you see is increasing the proportion of people at greatest vulnerability of acquiring HIV who receive combination prevention, for example, who have access to EBIs and condoms, who have access to syringe exchange programs and other support and harm reduction strategies. And through all of those, we believe that we can, at minimum, reduce new acquisition in Texas by 50% over the next 10 years. So y'all can stop me if anyone has questions in the chat. I'm not looking at the chat, but if anyone has questions, Michael or Jamie or someone can stop me. But that's the All right, that's the goals and the measures of achieving together. And I hope that you can see that those really align with the QM work that everyone does and supporting, supporting viral suppression among people living with HIV and supporting, retention and care across our agencies. Those definitely directly support these 90s and the goals of achieving together. I'm gonna skip HIV Texas in it for just a minute and we'll come back to it. The next tab is our blog. Every couple of weeks, there's a new blog posted on Achieving Together. And this is written by community members or by the UT team or by other folks who contribute to the blog. If people have ideas for blogs, if it, it would be great to have a QM blog at some point, then you can reach out and let us know. We're always open to hearing from folks about what they think might be interested, and people who want to author a blog on the page can also do blogs. But if you click on here, there's our 2 or 3 year history of blogs, and some of them, well, not some of them, they're all very, very good. Then there's the Get Involved page, which we have upcoming events, which is a calendar. We have a page here, or a subpage here for the Texas Black Women's Health Initiative to support that work. We have the public policy page, which is a new group of Achieving Together. We have a public policy work group that has been forming over the last 6 months. And they'll be working to pull the public policy issues that were described in the Achieving Together document and pulling that together and trying to create a platform and some priorities among that. But there's more information about that group here. There's also the conversation series. So part of Achieving Together, we do series of discussions, webinars, presentations around different topics. And so all of those are here. If you missed it, the last one was just a few days ago at the beginning of the week, which was Thriving with, and it was put on by the Black Women's Affinity Group of the Texas HIV Syndicate in coalition with several other groups. And then there's several others if you scroll through the history of that. And then we've got resources. If you click on the resource page, you can print the actual Achieving Together plan in English and Spanish. There's branding information here. If you are printing your own materials and you wanted to brand them or co-brand them with the Achieving Together logo and information, you can click on here and it will give you several different options of logos and information. There's also code down here if you wanted to put it on your own website on the branding page. And then under resources, you can look at resources by focus area. So we've broken out different resources by the different focus areas of Achieving Together. So you can see them here. There's a lot of different information. This is also always evolving and more resources are being added here. So that's really useful. For those of you who are either in Dallas, Austin, San Antonio, or Fort Worth, under the federal Ending the HIV Epidemic Initiative, DSHS worked with those 4 cities to produce a plan for those 4 cities over the last year. That plan is actually put into effect now. So if you're interested in that plan, you can click on here. This is a page, and this page will start to grow and expand. Eventually, we want to have each city having their own sort of sub-page on here with information. But right now, there's a brief description of it with the federal pillars, and you can download a copy of the Texas EHA plan that covers those 4 cities here. And it has all the activities that those cities plan to do over the next couple of years. So if you're not familiar with that and you're in those areas, I encourage you to go look at that plan and get involved with the planning processes there. And then just another shameless plug, we also support the Texas Transgender Alliance Resource Guide. This is a great resource. It will, if you click on it, it will take you to another site, but it's a great resource for finding trans-centered support services and services around the state of Texas. This is also something that's always growing, and we're hoping to be able to grow and do more with. So that's basically the overview of the resource page. Now the biggest page that everyone goes to on this site, and I think gets the most traffic, was HIV in Texas. If you click on this, just the major page, you can see here's the landing page for it with a couple of things. But under it, you have a couple of options. The first is overview of HIV in Texas. I think this is a great page and site to learn more about it. And I think right off the bat, Ann Dills did a lot of work to produce some very short data literacy videos around different data topics to try and encourage people to learn more about our data systems. Those are all here. They're all like 5 or 6 minutes long, and they're not that much. If you aren't familiar with, why data matters, or there's one here on our data sources to describe how DSHS collects data and what our data net looks like. And then there's a video on the treatment cascade to learn more about that. I think they're really great resources for you or for your providers. If people have questions or don't understand, the completeness of our data, then these are great things for it. And then we jump right into an overview. This is actually been updated. So this is 2019 data, hot off the presses, very exciting for Texas. And so you can see just that this is a great just general overview of HIV in Texas. You can see we had 97,000 people diagnosed and living with HIV in Texas in 2019. We had 4,000 new diagnoses in Texas. If you're not familiar with it, one of the goals of Achieving Together is to reduce diagnoses, new cases, and which will eventually bring down diagnosis, because we've had level diagnosis. Texas, we diagnose around 4,000 to 4,500 people a year. And it's been like that for the last decade. So we have to do more work to try and reduce new cases in Texas. I do want to make a note though, as we do that, we should expect diagnoses to go up. As we're trying to diagnose more people to reduce the undiagnosed population in Texas, we'll see that number go up. So people shouldn't be alarmed to think that like, oh my God, it's getting worse. No, actually, if we're diagnosing more people, that's a good sign. People get confused about that. So then we jump into, where most people living with HIV are in Texas. I'm not going to go into these things, they're here, but there's a lot of really great information. It talks about our priority populations. It breaks that down by people living with HIV and new diagnoses and by age. And then it gives you a broad overview of where we are in Texas in terms of the cascade, in terms of those big 90s. And then I think what a lot of you will be most interested in, if you haven't seen this, if you go to HIV by region data map section, you can pull up an interactive data map. It takes a moment of the state of Texas. So it'll show you these are where we currently are. I believe these are still 2018 data, but where we are in terms of retention and care and viral suppression. But the great thing about this is if you scroll over the map, you can highlight HSDAs and it will bring up the counties and the priority for that area based on where they are on the cascade. So you can see for Abilene, retention and care should be a priority in that area to try and improve retention and care. And then if you click on the area, it will adjust these to show you where your area is in terms of retention and care and viral suppression. And then again, it'll show you the counties. And again, retention is an issue or a focus should be a focus for Dallas. And then if you are interested, so for Dallas, there's also the continuum of care data packet that is downloadable. So if you click on that, it will open up the packet. Y'all can see the packet, right, Michael? I never know if it follows on the screen depending on how you share it. So you can download your HSDA data packet. Andils does a tremendous amount of work putting these together every year. She's actually working on the 2019 ones right now. These have a really fantastic overview of each of the HSDAs in more detail with some epi profile information, more information on who the priority populations are for that area, because we have the priority populations for the state overall, but there's variance whenever you go to local areas. So it has that information broken down in there, what the focus populations are, more information where we are on diagnosis, linkage to care, and then you get into the viral suppression. And I'm sure most of you have seen Andil's present on this data, and she does really fantastic presentations around the state. But if you're interested in more in what she's doing in those presentations or seeing that data, it's all in these data packets. So those are all located through this map. This page will be changing slightly over the course of this year. I think for the 2019 data, it's going to look slightly different, but it'll still operate the same way. You'll be able to go on there, click on the HSDA you're interested in, and pull up that data. And I think that Anne has actually worked quite a bit to expand the data packets this year. So there's going to be more information about undiagnosed populations in your areas and those sorts of things. And I think that's it for the Achieving Together website. That was really fast. so I can stop to see if there are any questions or anything.
So what do we think, folks? Jesse, you had a stream of kind of like cheerleading happening from me and Jamie and Julie in the chat room. And I think folks were absorbing. I know that y'all have, as Jesse pointed out, y'all have seen and heard some of this before, but the lens we're applying to it now is different. So let's think about that lens and what questions you might have, or if any of the comments that were entered in the chat room spurred anything for any of you.
So I see a question from Christy there in the chat asking, when will the 2019 data be released for all of the HSDAs? Any idea?
I'm not sure. I'm gonna stop sharing my screen for a second. I'm not sure, Christy. I know Anne is working on them right now. I know that you know, we have new review processes for stuff. So I know that the format has been submitted for review, and I think she pretty much has most of them done. They just like, I'm not sure where she is on them, but it's mainly getting the review done and the authorization to release them, and then they should be out. I'm not sure. I would hope within the next month, but we'll see. One of the other things, I need to go back to the team on that. Some of what you are talking about, like, you know, elevator speeches and those sorts of things. We had produced like a 2-pager on the plan. I thought was on the website. It is not. So I'm going to go back and see if we can get that posted under the resource page, and I'll let Julie know or everyone know when that's available, because I think that that's a really useful, you know, the whole document is pretty big, and not everybody wants to read that, but we do have a pretty great little 2-page overview of Achieving Together that I think is really useful for folks. So we'll get that posted on the website for people to be able to download and use as well. We also, if you're interested, COVID has sort of shut us down for a little while, but once we're all sort of back in the swing of things, we are able to mail out copies of materials. So we have a warehouse full of materials, like copies of the plan and 2-pagers and other promotional materials that we can send out to people. So once we're all back up and working in our offices and stuff, that'll also be an option. If you're interested in getting materials, you can email me or Rosa, or through the Join Us account on the website, and request some materials, and we can get those mailed out to you. That's the last thing I want to plug. I didn't on the website, and I would be in trouble by my people. There is an ability, if you go on the website at the side, there's a Join Us piece that pops up where you can click on it and enter your email to sign up for updates, and that way you'll get the Achieving Together newsletter that comes out every 2 weeks with more information about what's going on and talks about our blogs and some other really great resources. So I encourage you to use that as well. Thanks, y'all.
Fabulous. Thanks so much, Jesse. All right, so let me share my screen again, so we can think about elevator speeches. So the model that I like to use is called 27, 9, and 3. You know, basically you want to think Twitter. You want to think about 140 characters being a sweet spot in terms of the amount of information that you can convey in basically a soundbite, right? That would be absorbed and allow a person to ruminate and come back for more later. And it's supposed to be a quick communication tool. So the average English word is around 5 characters, which means that 140 characters translates to 27 words in 3 sentences if we have 9 words per sentence. 27, 9, 3. So something that we have, did I skip on something before? No, okay. Something that we have here in terms of some examples. Here's from the UNICEF Clean Water Campaign. Water is life. Yet 768 million people do not have access to clean, safe drinking water, and 2.5 billion people live without proper sanitation. When water is unsafe and sanitation non-existent, water can kill. So see the way here, this was like a sandwich model. Water is life, water can kill. It's about 140 characters. Like, we don't make perfect the enemy of good, right? Let's look at the other one. It's a little bit longer, so it's a little bit harder to maintain and a little bit harder to memorize, but it's fun, so that might help. Every new instrument involves risk. Show the dragons you understand what the risks are and how you will quell them. By the way, nothing makes investment risk in a startup go away faster than showing you have sales. Show the dragons your sales pipeline to get a deal done fast. So this is basically the idea that you can use sales pitches, you can use informative pitches, you can use action-oriented pitches, in creating an elevator speech, depending on the phase of your cycle, depending on the phase of your project, and depending on the way that you specifically want to engage people around the subject matter. In this case, we're talking about achieving together, right? So in your toolkit, there'll be several different tools that really focus on how to develop elevator speeches, different links that you can follow to identify, different types of speeches, and what might be appropriate depending on your cycle and your phase. So I'm wondering, if anyone, as I had said before, anyone who has already, let me take down the slides. Anyone who has already created an elevator speech for achieving together. If anyone wants to share what that might be, how have you engaged your subrecipients or other stakeholders on achieving together? Does anyone want to share? This is a safe space. I think I see some folks typing. Go ahead, Jamie.
Well, I was just going to say, this ties into the poll earlier, right? So maybe depending on topic, or maybe depending on who we're talking to, our level of confidence or comfortability changes. And I can speak for myself. This has always been a space I've struggled with, because I've had my grantee hat and my MPH glasses. And, I think I'm so used to writing federal reports that I over-explain. And I have a hard time keeping things short and sweet, so that it's kind of a digestible nugget of info and people can come back to it. So for me, the greatest challenge with elevator speeches is feeling like I have to be more comprehensive than I do. And I don't know if that's a shared feeling or not, but I'll go ahead and put myself out there in terms of what's been hard about that for me in the past.
Great to share that, and I think along those lines, Jesse just did such a great job showing us so much that the website does that job, right? The website and these tools, these resources, in terms of thinking about, achieving together an HIV data within your region, potential ideas of where you can focus your quality project based on greatest need, perhaps identifying at a high level what you can find on the website would be a great use of your elevator speech in this case, especially if we're trying to engage people for the first time in a very concrete and meaningful way, using this subject matter to generate applied projects on the ground in our settings. I'm going to call on some of our friends from Dallas to see what their thoughts are. What are some of the ways that we can talk about the emerging return to care project in light of achieving together? Any ideas come to mind?
Well, Michael, hi, this is Oscar. I am kind of trapped in a bathroom because there's a lot of, Nana didn't come over, so, but okay.
The joys of working from home.
Exactly, yes. Well, I mean, from the connection of the achieving together and the CQI project, exactly the retain and re-engage people that are out of care or are risk to fall out of care, actually feed one of the pillars, because the project itself will feed the retention in care and avoid that those who are at risk will be easy to catch, because they can be actually not labeled, but classified into the risky group of going back into falling out of care. So the project that we are actually starting at this time will re-engage people and will maintain people in care, and that group will create reasons why they've been out of care, and we are able to address at the subrecipient level what barriers they had to maintain this group, and keep an eye on them because those people are at risk, and is our population. I'm sorry about it's my intern.
No worries, no worries. That's great. That's great, you know, in terms of thinking about how to make that application that people can actually see your project on the screen on the Achieving Together website, and they can connect that dot for themselves. And you can try to connect the dot, but I think, like you said, pointing out where there are the synergies so people can follow their own intrigue and curiosity, you know, is a great way to do that. And I'm wondering if anyone else has felt inspired by what Oscar just shared. Is there a project in your area or a frame for a project that you're considering that you potentially could talk about in terms of achieving together, or, you know, generate a quick elevator speech now?
I'll take a stab at it since
All
everybody's
right.
quiet. As usual, you guys, you need to drink more coffee before these meetings. So our Create Equity team at the state level is totally trying to incorporate Achieving Together goals and initiatives wherever we can, right? So on our driver diagram, for example, we didn't just focus on care. We focused on getting people newly diagnosed into care and linkage. So we added a couple of layers that were beyond the Ryan White in care population. And that's kind of what you have to do to broaden the lens, right? To the whole state or to your whole region, and not just your folks that are already in care. The ones that are already in care are probably doing quite well, right? Because what we see is once they're in care, within like 30 to 60 days, they're generally suppressed. And then the other piece is keeping them in care. We looked at some data just for our age population, 25 to 39. And the folks that were enrolled in Ryan White outpatient ambulatory services was about 1,200 or so. And from that 600 folks did not have labs over the last 12 months. So there is a problem, right, of retention. So that's kind of how I'm thinking of how we can link those. And then of course, trying to expand on it as we learn and go and grow.
Fantastic. All right. Well, we are already almost halfway through our session. So I'm going to share my screen and turn it back to Jamie to go into the next section.
Sure, I did see Chrissy unmuted herself. So if you
Christy.
want to go, girl, you go right ahead.
Come on.
Well, so I find that as I'm interviewing for a new position or office, I'm actually doing some elevator speeches on the Achieving Together plan, but I didn't realize they were elevator speeches. They just are, because it's for a planner position. So clearly I need to talk to them about the syndicate and the Achieving Together plan. But also we have, we're not really talking to our service providers about Achieving Together because most of them are part of the syndicate. And then we have one particular staff in San Angelo who is doing a lot of stuff. It's backed down a little bit with pandemic, but she's working on getting opt-out testing in their hospital system, and she's ruffling a lot of feathers, which we're like, yeah, do that, go. So I'm like, elevator speeches, they're hard. They're not. You just, a lot of things that you do are elevator speeches. You just don't think they're elevator speeches. So yeah, that's all.
Yeah, that's awesome. I'm glad that you stopped and said that, because I think often in CQM programs, there's also areas where we're doing stuff, but we don't necessarily know we're doing it in that framework of certain terminology or certain methodology. And so I think that's really an important point to make. Elevator speech might be the thing where people are like, seize up and it feels weird, sometimes, but like we have done it. And I also really like that example and thinking about, elevator speeches don't just have to be for presentations or planning councils or leadership or, politicians or people like that. It can be in a job setting or, just in how we talk with our family. People ask me what I do, like, how do I just kind of put that in a short little sweet package? So I think that's a great example in terms of even within the, onboarding or hiring process. So cool. QL. All righty. So I think I mentioned at the opening that I'm super jazzed to talk about the organizational assessments and how they relate to achieving together. So in the next slide deck, we're going to start to see one of our main, we'll do a poll first, and then we'll get to one of our main objectives. So I think my friend Michael will be able to launch this for everyone. Alrighty, so we've got a couple of questions here. So we want to get the temperature from folks in terms of, are the funded HIV provider organizations in your region, are they aware of Achieving Together? Feel free to make your selection. Yes, all of them, some yes, some no, not at all, or maybe you're not sure. In terms of the second question we have here, how have you aligned your regional QI project to focus on Achieving Together? And again, we have maybe, yes, we've already launched a project that can be tied to Achieving Together. Maybe you're in the planning stage of a regional project tied to Achieving Together that's going to launch this year. No, not yet, but you're headed in that direction. And again, maybe you're not sure, and it's a safe space. So we've got about 50% of votes so far. We'll give it another moment. You guys have been pretty awesome in getting these clicks going, so we thank you. Maybe like one or two more, hit like a 70, 75%. Boom. Awesome. Thank you, Michael. Let's look at some results. All right, so our funded HIV provider organizations in our different regions aware of Achieving Together. Pretty overwhelmingly, majority, 75% said yes, all of them. So that's awesome. So again, maybe we've talked about it, or maybe they have some kind of, sort of participation in those pieces already. Some yes and some no. So that's a fine space to be. Hopefully some tools from today will help drive that up. In terms of aligning QI projects with Achieving Together, we have 50% of folks where they can say, yep, and it's happening right now. It's already been launched. That is awesome. And I think that creates a space, again, how we talked about maybe a CQM blog or other pieces related to that website to sort of update on those projects that are already underway. And then we also have a good majority of folks who are in that planning stage, but that alignment and that sort of framework for the project is already created and will launch later this year. And then again, folks head in that direction. So it's awesome that we all kind of know what we're doing and we know where we're headed. So we can close those poll results and get into what I was really excited to talk about in terms of relating those organizational assessments to Achieving Together. So we have kind of this cute little orange star, just to remind folks that this was one of our main objectives, right? For you to be able to kind of name and refer back to what are the pieces in the OA related to Achieving Together. And we see, I think, 6 domains here. Our workforce engagement, the performance measurement, and when we were looking at the website, something that struck me was not only things like the measures like retention and care or viral suppression, but some of those goals and sort of framing pieces were eliminating disparities. So we can apply our performance measurement in looking at disparities as well. So just as a reminder, in the coming months, we're actually going to have 4 more sessions that kind of take a deeper dive into this. So today we want to put out there what those domains are, for you to be able to recognize, but just know that we'll be tying them together in more detail coming soon. Just as a reminder, when we think of the organizational assessment, if you do well in certain domains and in certain areas, you can score well sort of in a number of other spaces. So this is important for efficiency, and this is important for sort of promoting, more rapid growth and capacity and change. So areas like the communication with stakeholders, again, performance measurement is huge. Having clear contract language with our subs or sub-subs, or however your contracts work out. Fostering a collaborative approach in the training of stakeholders. So, I see so much, like with the website we looked at and Achieving Together, we saw a ton about how we can communicate with stakeholders. So I think there's just a lot of areas, and Jesse specifically said, how there's a lot of places where these things tie together. So when you feel like you have limited capacity or limited funds, or you feel maybe a little overwhelmed by all the things to do or all the things to align, this provides an opportunity to focus within these domains to help you work with efficiency and kind of take a bite of the elephant, one bite at a time.
I think the other important thing, if I was just looking in the chat room, so if you already said this,
Okay.
please forgive me, but the green highlights actually bring in that overlap too that we just saw on the previous slide with achieving together. So in thinking about this, if you have a really strong achieving together implementation, and if you think about your communication with stakeholders about achieving together and everything related to it, if you include achieving together robustly in your performance measurement, and again, even just thinking about all the resources that Jesse had shown, a lot of the work just needs to be customized and tailored to your own setting. Port it over. Don't make perfect the enemy of good. As we say in quality, share senselessly, steal shamelessly. This would be a time to go ahead and steal. They have all the goodies for you. Take it. Put it in your work. Put it into practice on the ground. And that will really help to drive your OA score enhancement.
Awesome. Thanks, Michael. So let's think about how this, how this looks like in Texas and how this works. And we've shown this slide before, right? So this is kind of a space to reiterate. In terms of the organizational assessments, there's kind of a two-way channel, right? So we have our funder family at HRSA. We have DSHS as the recipient. We've got our AAs as subs of that, and then our providers who are the subs. So the way that these domains within the assessment work and the way that we roll out these sort of like high level initiatives and efforts, and then make that local and make that relatable to our communities, right? There's sort of one line of a continuum. But the way that the information rolls up from those same domains in the organizational assessments and what those actual activities look like in a given year, that goes sort of at the sub level. That's going to impact the way our AA organizational assessments look and score, which then in turn impacts DSHS. And then that assessment and evaluation is then able to roll up to HRSA. So again, it's kind of a roll up mechanism. And the next slide will also sort of detail what we're talking about. So, fast forward, rewind. All right, so, part of the amplification effect, right, is that the lowest common denominators do kind of set the tone in a lot of ways, and there is a regression to the mean. So we can leverage this granularity to show that sort of relationship and effect between service providers, our AAs, and DSHS. So when we have those, different sub OAs, we go out, we do 4, 6, 10, whatever it looks like in your area, right? That's going to create a specific score, and that's going to influence where you're at as an AA. And then we have this sort of AA family, right, which is then going to influence our statewide evaluation. And all this stuff matters because this is what forms our goals and our aims and our projects. And what's the stuff we need to train on? Is it things like data numeracy or some of those pieces that are even touched on in the Achieving Together website? Do we need to focus on the fundamentals of QI methodology and that QI life cycle? So the specific stuff is what's going to kind of dictate where we're headed and what we're doing well and we want to maximize, and opportunities for growth. So this can be super helpful, especially when you're communicating sort of those nuanced findings to stakeholders. This explains the why for the stuff that's happening. Reports also help to show high and low points in your regional network. So if you have, your sort of cohort of subs, and then the state has its kind of group of AAs, within all these organizational assessments, there's different scores. So we might see across all of the OAs, the lower scoring portions, maybe it relates to the HIV care continuum, maybe it relates to the workforce engagement. So it takes kind of a macro view of where are the hot spots of opportunity that's not only going to help folks in this AA, but it's going to help, across the state. And you can apply that same sort of approach within your subrecipient portfolio. Again, those reports then call forth and spotlight where you can also do a little twinning, right? So maybe we have folks over here in this part of the state and folks over here, and folks can learn from each other again, and you can sort of leverage and maximize the types of capacity assistance and TA that you're providing and get the most impact. So the statewide communication, again, also allows that kind of high performance stuff too, in terms of collaborating. And I think this is the space that we're creating, and we're going to be on a journey over this training series together to foster even more of this. Alrighty, friends, you might remember this slide as well. We also like to share this in terms of thinking about how guidance and alignment is always super important to what we do. So it ties into setting objectives and then monitoring those objectives, right? So we see that sort of interdepartmental coordination. We see key tasks, and we can break them into our quality control, kind of our QA components that we work in, but then we can also tease out what is the quality improvement lens, right? How do we differentiate and not blur the lines between quality control and QI? So we look at things like root cause analysis, and I think Michael had maybe put in the chat how some of this stuff was speaking to the discovery process that we've been going through. Again, things like our planning and those interdepartmental projects. So I don't know, Michael, if there's anything else you wanted to say about this slide, just because we've definitely kind of brought it up a couple different times.
Yeah, I think, in the first 4 sessions of our series, we focused a lot on how infrastructure is in one area, performance measurements in another area, and improvement activities are in another area. What this slide is trying to show is that achieving together actually is a unifying activity, right? Achieving together itself can help you inform your infrastructure. It becomes a substantial part of your plan, potentially. It becomes a substantial part of your CQM activities, potentially. It becomes a central focus of your performance measurement, hopefully. And it becomes a central focus of your QI projects, hopefully. And why I say hopefully for these last 2 items is that everything that we said, by aligning yourself with Achieving Together and by having a regional Achieving Together implementation, you're automatically aligning yourself with other provider activities like Create Equity, like Fast Track Cities, other regional activities like Fast Track Cities, like EHE, and national activities, right? So we can see by casting one stone, all of a sudden that one stone has a huge multiplication effect. And Achieving Together is a wonderful framework for us to be able to house our quality program, and it hits on all of those areas.
So well spoken. Okay, so I want to open this up for a little bit of discussion. I don't know if this resonated with folks in terms of, again, the OAs you've done maybe at your AA level or within subs, and how maybe Achieving Together has come up, especially as maybe some projects have already been launched or are launching this year, thinking of the spaces like performance measurement or communication. Any kind of initial thoughts or feedback on that topic of the OA Achieving Together connection? See a little chat activity. Julie says that she appreciates all the work each of the AAs are doing for Achieving Together. So thank you. Oscar, data is the challenge. I think everybody, and that can be a space for sure. And I think working through those challenges is pretty awesome. And, one of the things I think that Dallas has done so well is with different performance measure groups and those service categories that will be funded, right? Hosting kind of work groups and having those open and transparent conversations with subs and folding in qualitative and quantitative data. And anyone's welcome to speak to that. I don't want to, spoiler alert, share too much if y'all want to, but I think that that's been helpful in dealing with some of those data challenges. And data integrity. Yes, Bob, we hear that. I think you've got people who can relate. Also,
well, it's clear
ahead,
that we're all trying, right? We're all here together in the room trying to align our thoughts as we do our work. And that's we're working in the right direction for sure. And I've been reviewing all the CQM plans across the AAs, and I can see the changes since we started the series and just in the last couple of years, how things are starting to actually align more. So it's really exciting to see our progress as a state. And I thank you all for all the great work. I know it's hard and things are constantly changing and we're in a pandemic. So kudos to you all, and please keep up the good work, and please keep coming to our sessions so we can learn from you and work together. But sorry to interrupt.
Oh, no, absolutely. I mean, I love your contributions. And I think what's cool about the OA specifically is, again, this is an evaluation tool. So if we identify bumps in the road or challenges or spaces we need to tackle, that's okay. You can always kind of grow from that and, take concrete steps to figure it out. So finding that alignment, looking at your performance measures, looking at the way your QI projects maybe do or don't align with different activities. It's okay if you're starting at a 3 or a 2 or a 1, and through the OA, you make progress toward those different levels, which I appreciate that about the OA. Go ahead, Michael.
I was just going to say, Justin had mentioned that the 2-pagers came in handy when speaking with the task force. And I think that, there's quite a few ways in which, Dallas has worked to integrate Achieving Together into discussion processes. And so now it's taking that next step, like Jamie was alluding to, using Dallas as kind of like, a fishbowl. That we can all see into and kind of interact with a little bit. I think that the interesting thing is now taking the data piece out of, Aries doesn't have everything. Aries isn't perfect. Therefore, I don't care about data. That's been the way that a lot of folks have kind of like pushed, us, it seems, through the series and the feedback that we've gotten. So in Dallas, what folks are doing is saying, okay, you have your Aries, that's part of compliance. You're contractually obligated to enter Aries data, but your CQM measures are going to be extracted directly from your EHR and submitted to us separately. And then now we can have a separate conversation about a comparative analysis if we want to go that road, or we can just look at our EHR data about what is happening on the ground in our sites. And that's going to be a different level of this data integrity conversation, but it's going to end up, what we're trying to do is we're trying to take out the fake out kind of like maneuvers that people have in order to get expectations lowered, right? We're trying to find the excuses that are used, or, and sometimes the excuses are super valid, right? And then that makes us feel very disempowered. Well, they're right. So what do I do with that? You innovate a way around that problem or that excuse so that people are still on the hook to do the right thing. So I think that'll be really interesting. I don't know if anyone wants to share any other thoughts on this issue, because we are going to dive a little bit more into this in the next couple of slides. All right, yeah, Bob, I will be really interested in hearing more of your perspectives on this, because you've made some really great contributions in the chat, thinking about these questions. And so let's move on. Making it matter and making it count. I say a lot, context is king. Also, relevance is royalty, right? Like, you need to make people understand how this bigger project is very much related to their mission and vision, and very much the right thing to do right now in their setting. So we're going to have our last poll. So, do you see a role for all funded HIV service providers in your region to participate in the activities tied to Achieving Together? This isn't just being like, Achieving Together is great, but like, yes, all service providers will have some activity or project that they can say is their actual applied contribution. Second, when challenges arise in getting funded providers to participate in a regional QI project, what's the greatest cause of the challenge? Individual service providers pushing back and saying, no, I can't join the QI project because of data or because of time, or you ain't giving me no money. Or Is it because service categories don't really fit? So really, what's a dental program going to do about this? Or honestly, I have no idea how to make an APA project play into achieving together. And then, or a third option, we rarely encounter resistance to organizing regional QI projects. We have about 37% of the vote in. Let's see if we can bump her up to around 70, 75% again. Waiting for some more votes. I should have done a multi-select. I'm sorry about that. But for those of you who are having a hard time deciding, try to decide which one is the most important factor. Thanks for calling me in on that. All right, I'm going to end the polling and share. So everyone says that they can see room for all funded HIV service providers in the region to participate in activities. I think that's fabulous. And I actually think that we've come a ways as a group since we first started talking about these issues in the fall. And it's really gratifying to see that, you know, you can all see this. And also that we have basically a TA series / support group for us to be able to identify barriers and overcome those challenges and barriers together through workshopping in these series sessions. About half of folks are saying that individual providers kind of push back and they do the whole, no, it's not for me. No, you're trying to put a round peg in a square hole and all these different things that we feel. And so that's a big issue. And then, you know, I'd imagine that the service categories, there are specific service categories that tend to be the thorn in our behinds. And so we'll be able to work on that as well as we work our way through the next sessions in this series in coming months. And for those of you who rarely encounter resistance, you know, I'm fascinated to hear more about that. You know, what are some of the things? Is it a preemptive thing? Like you're so clear in your support and your language that there's really no room for people to do the fake out? Or is it just a regional quality culture of people that are super collaborative and super innovative and willing to share? I'd be really interested in hearing about that in the discussion or the chat room. So definitely feel free to let us know. Thanks for participating in that poll and for sharing. So we're going to go over some of the Achieving Together goals one more time as a reminder for how we can make this relevant to different providers, and especially thinking about the QI project portion of Achieving Together. So 1, increase viral suppression. 2, decrease HIV transmission. 3, eliminating health disparities. And 4, cultivating a stigma-free service environment. These things are things that have been on the radar since time immemorial in HIV, and things that we have had new tools for over 10 years now is when Gardner came up with the care continuum, right, in 2011. So we have a lot of time and resources, you know, on our side in terms of these goals and how to make them come to life in real settings. Importantly, what this is about is addressing social determinants of health and really going beyond the most proximal activities and thinking about penetrating deeper into the spaces in which we operate. And then secondarily, as a product of that, strengthening the safety net and care network. Once we have a sense of what the real need is, what are the real barriers that keep people from accessing care and appreciating the benefits of that care, we can quickly move in to shore up those weaknesses, to fill in those cracks, to fill in those gaps. So you can see that blue star basically is thinking about social determinants of health, and the yellow star is thinking about the network, right? So the combination prevention framework here, you know, has quite a bit in terms of our thinking about the way that we leverage our resources as a network, and in particular, how we address social determinants of health that are prevalent in behavioral interventions. And, you know, the social determinants of health also bleed over into PrEP and NPEP too, right? When we think about sex workers, when we think about people who do different types of work for survival. So there's many ways we can probably actually overlay blue and orange stars over each of these if we really pressed ourselves hard. But the important thing is that there are going to be there are going to be providers and stakeholders in each of our regions that really hum and buzz a lot about social determinants, or they really hum and buzz a lot about the failures of our safety net. And so this is the hook for them, right? We've got something for you here. You're our social determinants guy or gal, you know, and so we want you to be helping us to focus thinking about combination prevention on these behavioral interventions, on PrEP and NPEP, and really thinking about that access point, that nut to crack, so to speak, in order to access some of the people who, you know, have the potential to be really strong allies, but maybe sitting on the fence or kind of even outside right now. Again, thinking about how we can turn someone who's throwing stones into someone who is one of our biggest allies. When we think about our status neutral approach and our stars here again, bringing in our social determinants of health for our blue stars and our strengthening the safety net for our yellow stars. What I really like about thinking about it in this way is that really the bubble in the middle is all about social determinants of health, all about the facts of life. And to a certain extent, there are some safety net issues like in the center, but this is really our environment that we're starting in. And what we want to do with our safety net is to provide access to services, access to anything that an individual needs that really, really, really constitutes the safety net. So medication, access to other care, access to complementary therapies when and if necessary, access to daycare sometimes. Like when we think about income stabilization, that sometimes means getting people to work. And so getting people to work, you know, it's a similar conversation that we're having right now around COVID too, right? So we can even take something that's another infectious disease process and overlay it to help people understand what's really going on here. Why are restaurants not opening? I don't know, because that's where most people died. Hi, you know, I don't know, because there are lots of people who can't find childcare, you know? So just thinking about that, applying something else as an example that's a kissing cousin like COVID, or even something that's totally different, you know, might be a way to help people understand, you know, the true sense of where they can make a difference here. So now we're going to go through a bunch of different ways that you can make a case. And when we're talking about making the case, this is going back to our elevator speeches, right? So here's the stuff that we can pull out threads that would become elevator speeches. So we can talk about this with any stakeholder. We can talk about it with our AA colleagues. We can talk about it with people living with HIV. We can talk about it with our HIV service providers or anybody else, frankly. Religious communities, immigrant serving organizations that may not even be part of Ryan White. Think broadly. And thinking about making the case, this is the right thing to do. This is the right thing to do to address social determinants of health. Many organizations really have already gone this way, right? To explicitly mention these. So what you would want to do is to pull right from, you know, you're going to have a conversation on Tuesday with a certain organization, go on their website on Monday and look at their vision and mission and apply achieving together to their vision and mission. Get the executive director on the phone. Hey, the more the merrier. You know, I think that a lot of times, even if it's not explicitly mentioned, you can still bring in a sense of identity. This is who you are as an organization. This is in your organizational DNA to be doing this stuff. So, you know, we'd love your feedback, your input, your participation. So we can think about this not just in terms of determinants of, but addressing disparities. Again, many organizations have adjusted their vision and mission to explicitly mention disparities. And if they're not, it's still part of their organizational DNA. That too, addressing disparities is part of our dialogue, especially over the last year, about what is the right thing to do. Addressing stigma, it's the right thing to do. The great thing is that we have additional tools and resources all the time in this area. When we're talking about self-stigma, when we're talking about associated stigma, when we're talking about structural stigma, you got it, you name it, we got it. And IAPAC and a couple of other NGOs have been wonderful research partners in developing this subject matter. NMAC has many projects that are focused right now on addressing stigma in an intersectional way, which I think is really important. And again, feeds into, this is the right thing to do. Ending the epidemic, it's the right thing to do. We have a lot of resources available at the national level around this. It's the right thing to do. The time is right. We have the resources, we have the passion, we have the tools. All we need to do is lend enough of our attention and focus to these areas to align those stars so that we can make a difference and do the right thing. So see what this is? This making a case is all about the right thing to do. And there will be some people that very much jog with the right thing to do. And there are some people that'll be like, good for you as an outside group telling me who my organization is, you can bugger off. So maybe this isn't going to be the right argument for all people. Maybe you won't know if it's the wrong argument until you try it. But guess what? We got more. How about making a case? Because you gotta. Take it back to the contract language. You want to keep getting funded? Guess what? You sign the line. You are on the hook, sis. Sorry, not sorry. Because you gotta. How would your organization continue without the funds? What about the people that you serve? How would they be affected if you lost your funding? What would you do with your staff? Go there. Go there. Use OA findings to inform your annual site visit process too. It doesn't need to be just on the surface. I said so, you have to, right? Use the contract language. Use the organizational assessment findings. Point out the deficiencies. The deficiencies in their programs amount to findings that can land on a corrective action plan. We've been talking about this a little bit. We're going to be going there much more with you over the rest of this series. Guess what? If deficiencies land on a cap, whoop, yep, they're on the hook for reporting it, 5-page essay, once a quarter, or whatever your process is, right? So, there's a couple of ways that we can leverage this. Maybe it's the right thing to do. Maybe because you gotta is the way to go about it. But of course, these aren't the only tricks that we have. We also have peer pressure. That's a fabulous thing to use, right? Because so many of us are in competition anyway. So you create that sense of friendly competition. You get stakeholders excited to ask questions of organizations they're affiliated with. And you want to, share as much as possible with a large audience and let the consumers go to their provider organization and ask the hard questions. Let the board members of their organizations ask the hard questions. And let the staff of the organization, basically defend a position of, I don't wanna, or this ain't right for me, or I just don't wanna look at it right now. The competitive spirits, it can be leveraged where appropriate, but you need to be careful with that, right? Because we do want to foster a network. We do want to foster a healthcare neighborhood. So make comparisons about neighbor A versus neighbor B, agency A versus agency B, in as productive and gentle a way as possible to coax them into doing the right thing. In the end, this really is all about doing the right thing, right? But there's different tricks and levers that we have. Some folks will always seek to excel and to do the right thing, but others are going to, be recalcitrant. And you're going to have to say, well, we gave you that contract, which looks awfully nice to me. And if you want to keep it, well, sis, another way to go about it is the peer pressure. But really, again, it's all about doing the right thing. So I'd love to pause now and to see what some of your thoughts are. I see that there was some activity in the chat room. I don't know if those were like hoo-ahs or if they are kind of like more questions or concerns, but what do you think, folks, about these different cases we made and about this session overall and the way that we can really leverage the resources we have to get the providers and other key stakeholders to act on the ground?
I think when we explain to them, it's in your contract, you agreed to this. But then when we also talk to them about we all have the same goal, and that's improving client health. And this is a way to do it where we can measure. And I think it's not that they don't necessarily not want to do it, but it's the time and the work of, not the work of doing the work, but the work of documenting the work is what is the holdup for a lot of people. And so we try and make it as easy for them as possible. And some are better at it and about it than others. But so we just keep trying until we get everybody on board. And that's all we can do, because they're doing the work. It's just getting them to document it and write it down. And that's where some of them are not as good.
Yeah. Have you found that there are opportunities to kind of help people, and not to like make a remedial class, but for people that are really struggling with certain things? Do you provide focused TA to a subset of providers, or do you prefer one-on-one as a way to go about that?
Both. Like we'll do a session for everybody, and then we'll do more focused TA for the folks who need it. And then some that are like the most willing to do things, they have the worst viral load suppression rates. I'm like, well, are you just? I don't understand that.
Yeah. No, I've found that too, you know, and it's an interesting thing. And sometimes it's just because like internal systems within organizations, and that's the beast that you're really fighting, is that like documentation is so hard, like pulling performance measurement data and then reporting it is really a laborious process. And so they're like crossing their fingers and knocking on all the air and wood when they submit it. Please don't have any follow-up questions. Please, for the love of God, don't have any follow-up questions. And I think that is something that's really interesting, and that you find when you do that provider level OA, it's really an opportunity to get on the ground with people and to see like what's really up here, you know, and in a very safe environment, let them, you know, voice where they have these, you know, challenges. And it might be something that is a little awkward at first, especially for some. But over time, I think that people really value that, especially when you as an AA, many of us in the CQM role have the benefit too of being a pure TA face, you know, as opposed to having that kind of like, you know, more none with a yardstick approach that our compliance partners have. And so we're able to do that good cop, bad cop mix, you know, where as the CQM person, we can be like, let's keep them out of your hair. Tell me what you need. Right? And that really helps to build people's faith and trust in you. I see Caitlin, you know, you're unmuting and turning your camera on. Tell me, what's up?
Yeah, hi, good morning. Sorry, everyone. I normally am more vocal, but we had some emergencies this morning. I have to say, Michael, you're so right. Sometimes we're the good cop in all of this. I've had to use that method quite a few times. But for us, like Christy said, it's a contractual requirement, and we rely on that pretty heavily. But we've also given them a lot of the autonomy to make the decisions. But we, so for example, for the Create Equity Collaborative, we selected an intervention, and we kind of made it mandatory for all subrecipient agencies to participate. Now, obviously, the intervention may not apply specifically to a housing agency the same way it would apply to a clinic. But what we did was we provided a list of 65 different quality activities that we created in the AA with our co-chairs, which are HIV positive individuals. And then we provide that list of 65 different recommendations. And we said, hey, subs, okay, look at this. You choose the 5 that you want to do. And so it's them making these decisions, but it's us really guiding those and showing them, hey, this is how we connect to improving disparities or reducing barriers or health outcomes. And so it's kind of one of those things of, it's really teamwork, but it's guided teamwork in the fact that we want to make sure that it's not just those easy activities, you know, a quick policy change, but there's really no follow-up. or attending a cultural humility training, but really not implementing that to improve patient satisfaction. So kind of guiding them into activities and metrics that will improve those things, but still making it their decision.
I love that. Thank you so much for sharing sharing those tips. It's fabulous, fabulous, fabulous. And I love that basically what you're saying is you've created like bumper lanes, you know, and that even your process itself, thinking about that list of 65 was a deliberative team-based process. This was not one or two people being like, this is it. This is the full picture, which of course, you know, the dialogue over the last year has pointed out so plainly for us that even the best intentioned people are just those people. They can't be inside the hearts and minds of everybody else. So thinking about that initial listing itself and how you created a deliberative process, not in a silo or island, is so powerful and fabulous.
I also think sometimes it's easier for the AA to get client or individuals living with HIV feedback and incorporate it into what we do. You know, sometimes when you are in a clinic setting, you're in a dental clinic, you're in an ASO, you are insanely busy, right? Staffing changes, crises every day. And so having a cab and then taking that information, listening to it, and then implementing it into system-wide changes can be really time consuming. And so when it's kind of that responsibility is taken away and it's more so just kind of told to you or delegated through policy changes and things like that, it's shaping the way that we deliver services. So that way it's by people living with HIV, for people living with HIV, but it is easier than having to do all the work yourself. So that's kind of been really big for us, is our community advisory board is telling us exactly what they need from subs, and we are then implementing those changes.
As a person living with HIV, I resonate very, very much with that. And like to hear that very much. All right, let's come back to the presentation because we are
Michael, I see Sonia Hughes has her hand raised.
Oh, hey, Sonia.
I guess she took it down. Maybe it was an accident.
Are you muted and you're trying to share? All right. Well, if you unmute, talk over me and I will pipe down so that you can chime in. All right. So just a reminder, we have a lot of resources that we have at our fingertips. PCN 1502, that FAQs that go with that. Hopefully that helps to kind of point to draw these connections for you, but there's a lot of hearts and hands on deck to help you with all of this. And as was mentioned, we have several more sessions coming. We have one coming up on the 14th of July, advising on provider CQM infrastructure. And this is going to be based on thinking about achieving together framework and the provider level organizational assessment and how we make connections between these two so that we can really, you know, I believe Caitlin was hitting on it very well, thinking about how our infrastructure can become rooted in achieving together and informed by these other processes, because our partners at the state have already done so much work for us. So it's that's coming up on July 14th. On September 16th, we're going to be exploring CQM performance measurement and thinking about the performance measurement aspects of achieving together, how that relates to the organizational assessment, and really teasing out a little bit more some of those opportunities and options we've already been discussing, qualitative versus quantitative, where we want to have something rooted in the HIV care continuum versus when we really need to hear more about like how that felt or what that meant for people living with HIV receiving those services, right? Since we already have areas anyway, a qualitative foil. Advising on provider quality improvement projects coming in November. Another thing to keep in mind, as with today, all of our future sessions are 90 minutes. That's something that you had all said was very important to you, was to be better stewards of your time. So we hope that we hit that mark today. And the next 3 sessions, we should point out, will also have a breakout approach. So pure AAs that are all pure Part B AAs with no Part A will be in one. Large AAs that have a Part A core will be a second. And the AAs that are also overlapping with a Part A would be a third. So we're really, really trying to meet your individual needs as an AA so that you can learn from and with your peers on how to apply this learning. And with that, I don't know if there's any other questions, comments, concerns, and I would love if y'all could just stick around 1 minute and fill out this evaluation. Oop.
Also, I'd
Sorry.
like to request that for the next session, that's going to be around infrastructure. I see a lot of CQM leaders here today, but whoever isn't here, I would love to have the leadership involved because they're really the decision makers that can influence infrastructure. So if at all possible, try to talk your leaders to come into the next session.
And your evaluation is so important to helping us understand how to create these sessions. As we mentioned, we just made a shift from the way that we had done the last 4. So please let us know whether we hit the mark. We don't take it personally. We just make it better for next time. So please let us know. And thank you so much for the participation today. I thought that this was a really fabulous conversation. We had a lot of great input and feedback from a number of you. And I can't wait to hear your thoughts and your leaders' thoughts when we get to our next session in July.
Have a great day, everybody. Thank you so much for joining us today. We really appreciate all the work you do for CQM and your commitment to quality.
Thank you.
Thank you.
We're really
Thanks,
making some changes and difference, and I can see it in the numbers on outcomes. So great job.
Happy Friday, everybody.
Thank you, Michael and Jamie. You guys are awesome as usual.
Thanks. You too, Julie.
Thank you. Bye, y'all.
Bye-bye.